While the recent Supreme Court ruling on the Affordable Care Act found that a majority of Americans now support President Obama's signature health plan, even bigger majorities support the government-run plans of Medicare and Medicaid, which turn 50 years old today. A new Kaiser poll on the two programs found that more than two-thirds of all Americans support the government-funded health programs. Medicare, which provides health care for all U.S. citizens aged 65 or older, is more popular than Medicaid, which covers health care for poor mothers, children, and the disabled. Today, about 55 million Americans are enrolled in Medicare. Despite its popularity, it has constantly faced attacks, and various attempts have been made over the years to chip away at it. But my guest believes that the best way to make Medicare better is to actually expand it. Dr. Garrett Adams is a longtime pediatrician in Louisville, Kentucky. He is the past president of Physicians for a National Health Program. He just wrote an essay on Medicare entitled Celebrate Medicare's 50th Birthday by Expanding It to All. Welcome to Uprising, Dr. Garrett Adams.
Thank you, Sonali.
Thanks for joining us.
Thank you so much.
Can you give us a brief history lesson? How exactly did American seniors get health care before Lyndon B. Johnson signed Medicare into law exactly 50 years ago today? I mean, once they were 65 and retired, back then they didn't exactly have much income unless they were super wealthy or had a lot of savings, right?
Well, only 56% of Americans older than 65 were insured on July 30, 1965. So half of them were not insured. Many were in poverty. Medical and hospital care provided to seniors was often given as a charity. Americans generally suffered poor health, and health care disparities were the norm, especially in the South, where hospitals remained segregated. After Medicare was enacted, hospitalizations and physician visits increased. Access to outpatient services expanded. Self-reported health status among beneficiaries improved, and poverty among seniors decreased.